Hello guys, in this part I want to talk about the sympathetic division of the autonomic nervous system. The sympathetic division can prepare our body for exercise, emergency, and excitement, and we call it fight or flight division. As I told you before, this division can originate from the thoracic part and lumbar part of the spinal cord. So we call it thoracolumbar division. The ganglia are close to the central nervous system, but the anatomic pathway of this system is a little complicated. And now I want to talk about this part. If you look at this picture, you can see the sympathetic division. The sympathetic division is much more anatomically complex than the parasympathetic division. The sympathetic periganglionic neuron cell bodies are located in the lateral horn of T1 to L2 region of the spinal cord. From there, the periganglionic sympathetic axon travels with the somatic motor axon to exit the spinal cord through first the anterior root and after that T1 to L2 spinal nerves. However, these periganglionic sympathetic axon remain within the spinal nerve for only a short distance, as you see here when they come out of the vertebral column. In this system, we have the sympathetic trunk and sympathetic ganglia. Immediately lateral to the vertebral column and anterior to the paired spinal nerves are the left and right sympathetic trunk. And you can see these two sympathetic trunks which are located on both sides of the spinal cord. The sympathetic trunk looks much like a pearl necklace. The string of the necklace is composed of bundles of axon, whereas the pearls are the sympathetic trunk ganglia. These ganglia are called paravertebral or sympathetic chain ganglia, which house the sympathetic ganglionic neuron cell bodies. One sympathetic trunk ganglia, as you see here, is generally associated with each spinal nerve, as you see in this picture, from T1 to L2. But we have three cervical sympathetic ganglia which are located in top. In this part, we have superior, middle, and inferior cervical ganglia, as opposed to 8 cervical spinal nerves. The superior cervical ganglia, as you see in this picture, contains the neuron cell bodies which axon are distributed primarily to structures within our head and neck, and also the thoracic viscera. As you see here, it can go to our eye, to our salivary gland, and a small part can go to the thoracic viscera. These postganglionic axon innervate the sweat gland and the smooth muscles in the blood vessels of the head and neck, and and they can dilate the pupil of our eye and the superior tarsal muscle of the eye, which can elevate our eyelid. The middle and the inferior ganglia house neuron cell bodies that extend postganglionic axon to the thoracic viscera. As you see here, in the thoracic region, we have heart, we have lung, we have esophagus, we have bronchi and bronchioles of our lung. So you see that the cervical sympathetic ganglia has 3 ganglia here. The superior can go to head and neck, and a small part of it come to our thoracic viscera, but the middle and inferior completely innervate the thoracic viscera. Now I want to talk about the different pathways which we have for this sympathetic division. But before I talk about this pathway, I want to show you this picture. This picture can show you the sympathetic trunk. As you see here, this is the sympathetic trunk. This is like a pearl necklace. You can see the axon like the string of your necklace, and these pearls which are the ganglia which we have between them. And pay attention. If you remember from the spinal cord chapter, I talked about the spinal nerve for you. I told you that if this is the spinal nerve and come out of the vertebral column, it divides into three branches. One branch is called posterior ramus, and the posterior ramus can go to the muscle and the skin of our back. One branch is called anterior ramus, which can innervate the muscle and the skin of our front and the lateral side of our body, also upper limb and lower limb. And between them, we have a branch which we call it rami communicant. And the rami communicant itself has two different branches. One branch is called, as you see in this picture, gray ramus, and one branch is called white ramus. And now I want to talk about this gray and white ramus. Connecting the spinal nerve to each sympathetic trunk is called the rami communicants. The white rami communicants or white rami are composed of periganglionic sympathetic axon from T1 to L2 of the spinal nerve to the sympathetic trunk. White rami are associated only with T1 to L2. Pay attention, T1 to L2. And because this part is myelinated, the color of the fibers become white. Because of that, we call it white ramus. If you look at this picture, you can see the white ramus here. The neuron cell body is located in the lateral horn, as you see here. Then you can see that with the ventral root, these sympathetic fibers come out. Then they go to the spinal nerve, and when they go to the spinal nerve, you can see something like the entrance ramp here of the highway. This is the white ramus. This white ramus come to the highway, which is the sympathetic chain, and then when it comes to the highway, as you see in this picture, one branch go out of the highway, which we call it exit ramp. This one is the postganglionic neuron, which can make synapse with the periganglionic neuron in the sympathetic trunk ganglia. This nerve, which come out and exit our highway, is called gray ramus because this one is unmyelinated. And when we have unmyelinated axon, the color of the axon become gray, like the white matter and gray matter which we have in the central nervous system. So this is the other thing which you need to know about this sympathetic division. The other part which I want to mention here for you is the paravertebral ganglia, which we have on both sides of the vertebral column. We have a group of ganglia here, which we call it perivertebral ganglia. Splanchnic nerves typically terminate in perivertebral ganglia, which can call them collateral ganglia too. The splanchnic nerve are the nerve which can innervate our viscera in the abdominal and pelvic region of the body. In this part, we have three ganglia. As you see here, these three ganglia are located anterior to the vertebral column. And they are located only in the abdominopelvic cavity. We don't have them in the cervical part or in the sacral part, as you see in this picture. The first one is called celiac ganglia. It's located adjacent to celiac artery. Because of that, we call it celiac ganglia. And it can innervate some organs like the spleen, the liver, the gallbladder, some parts of the duodenum, and also the stomach. The next one is called superior mesenteric ganglia, and it's located adjacent to superior mesenteric artery. This part can innervate some parts of our duodenum, the remainder of a small intestine. As you see in this picture, the proximal part of the large intestine, some parts of the pancreas, and the kidneys, and also the ureters. And the last one is called inferior mesenteric ganglia. It's located near the origin of inferior mesenteric artery. You will learn about these arteries later in ANP2. And this part can innervate the distal part of large intestine, the rectum, as you see here, the urinary bladder, the distal part of the uterus, as you see in this picture, and most part of our reproductive organs. So, as you see in this picture, we have two types of ganglia. A group of ganglia are located on both sides of the spinal cord. We call them paravertebral ganglia, and a group of them are located anterior to the spinal cord, and we call it perivertebral or collateral ganglia. Now, I want to talk about the sympathetic pathway for you. And I told you that the sympathetic pathway is a little complicated. The sympathetic pathway are divided into four different pathways. The first one is called a spinal nerve pathway. And now I want to talk about it. The spinal nerve pathway extends from the spinal cord to effectors of the skin of the neck, our trunk, and our limb. The skin effectors include the sweat gland, smooth muscles, which can form arrector pili muscle in the skin, which can make goosebump if you remember from our last sessions, and the smooth muscle cells in the wall of the blood vessel. In this pathway, the periganglionic neuron can synapse with the postganglionic neuron in the sympathetic trunk ganglia, either at the same level or at the different levels. Look at this picture. If you look at this picture, you can see that the nerve cell body of the periganglionic neuron with the brown color is located in the lateral horn of the spinal cord. The axon comes out of the spinal cord through the ventral root, and then it goes to the spinal nerve. As I told you before, it goes the white ramus, which is the entrance ramp of the highway, and go to the sympathetic trunk ganglia and the sympathetic trunk. Sometimes from this one and sometimes from the other one in the next level, it can make synapse with the postganglionic axon. Here it goes to the next one, makes synapse with the postganglionic axon, which its color is green. And it's unmyelinated. And then it comes out of the ganglia and the highway from the exit ramp. And then it can go to the organs and to the parts which I mentioned for you. So this is one of the pathways which we have. The other pathway is called postganglionic sympathetic nerve pathway. And in this pathway, we have innervation of some internal organs in the thoracic cavity. like esophagus, heart, lung, thoracic blood vessels, and also to the effectors of the skin of the head, like the sweat gland, arrector pili muscle, the blood vessels of the skin, and the neck viscera. The superior tarsal and dilator pupil muscle in our eye can adjust the amount of light which need to come to our eye. As you see in this pathway, the periganglionic neuron is located and it's originated from the lateral horn of the spinal cord. And then it passes, as you see here, the ventral root here and come to the spinal nerve. And then it enter the white ramp and come to the ganglia. The postganglionic axon here doesn't leave the trunk via the gray ramus. It doesn't use the exit ramp. And immediately from here, it makes synapse and the postganglionic go to the viscera and project to the viscera. So this is the other pathway which we have here, and we call it postganglionic sympathetic nerve pathway. The other sympathetic pathway which we have is called a splanchnic nerve pathway. In the splanchnic nerve pathway, which extends from the spinal cord to the abdominal and pelvic organs like a stomach, a small intestine, and kidney, the pathway is like this. The periganglionic neuron, which starts from the lateral horn of the spinal cord, pass the ventral root, come to the spinal nerve, then enter the white ramus, and come to the ganglia. But it passes the paravertebral ganglia and come to the perivertebral ganglia, which are located anterior to the spinal cord. So as you see here, we don't have any synapse in this region, and it completely passes the sympathetic trunk and come to the Sorry, I have a disconnection right now. Come to the perivertebral ganglia, and then from the perivertebral ganglia, as you see here, the postganglionic axon start and go to the viscera. So this type of pathway is called a splanchnic nerve pathway. The last pathway which we have here is called adrenal medulla pathway. In the adrenal medulla pathway, first you need to know that the adrenal gland is the structure, is the gland, it's endocrine gland, and it's located in top pole of our kidney. The adrenal gland itself has two parts. One part is located around, we call it cortex. You can see it by blue color here. And one part is located in the middle, and we call it medulla. In this pathway, the periganglionic neuron starts from the lateral horn of spinal cord, pass the ventral root and the spinal nerve, enter the white ramus, and from the white ramus it can go to the ganglia, and from the ganglia, without making any synapse, it can pass the sympathetic trunk chain and come to the perivertebral ganglia, which is located anterior to the spinal cord. Again, here it doesn't make any synapse and directly go to the adrenal medulla. In this picture, you can see that we don't have any postganglionic axon. We only have the periganglionic axon. This is the myelinated axon. It passed the sympathetic trunk ganglia, the perivertebral ganglia, and go to the adrenal medulla. In the adrenal medulla, it can make synapse with the cells which can make epinephrine and norepinephrine. Stimulate these cells, and these epinephrine and norepinephrine release in the blood. The epinephrine and norepinephrine, which is secreted here, is a hormone. Its chemical structure and its function is completely the same as the epinephrine and norepinephrine as neurotransmitter, which is secreted from the nerve ending. But here, the epinephrine and norepinephrine release in the bloodstream, but that neurotransmitters, epinephrine and norepinephrine, release on the effector organs. They about 80% of the secretion is epinephrine and 20% norepinephrine, and by the bloodstream they can go to the effector organ and they can enhance the function of sympathetic stimulation. So when we are in the emergency, stress, exercise, and excitement, besides our sympathetic activation, we have activation of adrenal medulla to secrete more epinephrine and norepinephrine for us. So these are the different pathways which we have for sympathetic division. And we have the other part in our autonomic nervous system, which we call it enteric nervous system. The enteric nervous system is the nervous system which is located in our GI tract wall. This system is located between the muscles and the connective tissue which we have in the wall of gastrointestinal tract. And it can innervate smooth muscles and glands. By innervation of a smooth muscle, we can control peristalsis and movement in our digestive system, and by working on the glands, it can regulate the secretion of glands which we have in digestive system. And we have two large plexus here. One of them is called submucosal plexus or Meissner plexus. The other one is called myenteric plexus or Auerbach's plexus. Now I want to talk about dual innervation. The meaning of dual innervation is most of the organs in our body can receive information from sympathetic and parasympathetic fibers. These two divisions work antagonist to each other, work opposite to each other. And sometimes in our body, they can work with each other, which we call it complementary function. And now I want to talk about it. First, about the antagonist effect of sympathetic and parasympathetic. Commonly, the two divisions are oppose each other, like control the heart rate. The parasympathetic activity can slow heart rate, while the sympathetic activity can increase the heart rate. And our cardiac muscle cells have both receptors, cholinergic, which work with the effect of acetylcholine from our parasympathetic division, and adrenergic, which works by the activation of sympathetic stimulation. And we have release of epinephrine and norepinephrine here. The other one is the control of muscular activity in our GI tract. The parasympathetic activity increase GI tract motility, while the sympathetic activity decrease the motility of our GI tract. And GI smooth muscle cells have both receptors, cholinergic and adrenergic receptors. The control of the pupil diameter of the eye of our eye is controlled by the sympathetic and parasympathetic division. Parasympathetic can decrease pupil diameter, while the sympathetic activity can dilate it. Parasympathetic fibers innervate circular iris muscle, and sympathetic fibers innervate the radial iris muscle of our eyes. But in one part of our body, they work together. Cooperative effect of the sympathetic and parasympathetic fibers can be seen in sexual stimulation. At the time of sexual stimulation, these two divisions should work together to complete the task. When, for example, in the male, the penis erection is due to the parasympathetic activity, while in the female we have clitoris erection, and ejaculation of penis and clitoris, both of them are due to sympathetic activity. So you see that both of them should work together to make first erection and then ejaculation. We call it cooperative effect or complementary effect of the autonomic nervous system. And you need to know that only 3 parts of our body can be innervated by sympathetic division. They don't receive any parasympathetic fibers. And for remembering these parts, we have the word A. A here represent the adrenal medulla, B represent the blood vessels, and E here represent the effector of the skin, the sweat gland and the arrector pili muscle. These parts can only be innervated by sympathetic division. We don't have any parasympathetic innervation for our adrenal medulla, for the wall of blood vessels, and for arrector pili muscle and the sweat gland of the skin. And in the next slide, you can see the difference between sympathetic and parasympathetic activity. The parasympathetic can constrict the pupil, while the sympathetic can dilate pupil. Parasympathetic can stimulation of salivary gland, and you see that during sleeping we have drooly mouth. But the sympathetic division can inhibit salivation, and when you are in stress, you have dry mouth. The parasympathetic can slow heartbeat, while the sympathetic can increase heartbeat. The parasympathetic constrict airways, and the sympathetic can relax them. The parasympathetic can stimulate activity of the stomach, gallbladder, and intestine, while the sympathetic division can inhibit the activity of the stomach, gallbladder, and intestine. The parasympathetic can contract bladder, while the sympathetic can relax bladder. And the sympathetic division can secrete epinephrine and norepinephrine from adrenal medulla too. And the last slide of this chapter is a table, and you need to complete this table, the parasympathetic effect and sympathetic effect on different parts of our body.